Hello and welcome. If you or someone you care about is living with Waldenstrom's, you know it comes with its own set of challenges. Today, we're going to tackle one of the most common and frankly frustrating complications that can come with it, peripheral neuropathy. Do any of these sound familiar? That tingling in your feet, maybe some trouble with your balance, or that feeling of pins and needles that just doesn't seem to quit? If you have Waldenstrom's, or even its precursor, IgM-MGUS, these kinds of symptoms can be confusing, maybe even a little scary, but I want you to know you are definitely not alone in this. In fact, far from it. We're talking up to half of all patients with Waldenstrom's, or IgM-MGUS, experience peripheral neuropathy. And for a lot of people, about a quarter of them, these nerve issues are the very first clue that something is going on in their body. So, let's break this down. What exactly is peripheral neuropathy when we get right down to it? Okay, think of your body's nervous system like a complex electrical grid. You've got your main power plant, that's your brain and spinal cord. Peripheral neuropathy is what happens when the wiring that runs from that power plant out to the rest of your body gets damaged. These are the nerves that let you feel, move, and, well, live. Now, the symptoms you feel really depend on which wires are getting frayed. If it's your sensory nerves, you get that numbness and tingling. If it's the motor nerves, that's when you might see weakness or problems with balance. And then there are autonomic nerves, the ones that handle all the stuff you don't think about, like your heart rate. Damage there can cause a whole other set of issues. So the big question is, why? Why is this so common for people with Waldenstrom's? Well, it's not just a coincidence. There's a very specific reason this happens. And it all comes down to the stuff called the myelin sheath. This is the protective coating, the insulation that wraps around your nerve cells. Its job is to make sure the electrical signals from your brain travel fast and clear. And in Waldenstrom's related neuropathy, this insulation is target number one. This is just the perfect way to think about it. Imagine an electrical cord. The myelin is that rubbery plastic on the outside. If you start stripping that insulation away, what happens? The wire shorts out. That's exactly what's going on inside the body. And this shows you just how that short circuit happens. So in Waldenstrom's, your body is making way too much of one type of antibody, called an IgM protein. In about half the cases of neuropathy, a specific type of this protein, called anti-MAG, basically goes rogue. It gets confused, and it starts attacking your own myelin, stripping away that vital insulation and causing the nerve to short out. You might be wondering, why does it always seem to start in the feet? Well, it's actually pretty simple. The longest nerves in your entire body are the ones that run all the way from your spine down to your toes. More nerve means more myelin, and more myelin just makes it a bigger, easier target for those rogue IgM proteins to find and attack. Okay, so this is all happening, but how do your doctors figure it out for sure? How do they confirm that it's the Waldenstrom's and not something else causing your nerve issues? This is such a critical step. Well, first, they have to play detective. Neuropathy can be caused by a ton of different things, like diabetes or vitamin deficiencies, so a neurologist's first job is to rule out all of these other usual suspects to make absolutely sure they're focused on the right problem. Once those other causes are off the table, they can bring in the specialized tests. The anti-MAG antibody blood test is a huge one. It looks for that specific troublemaker protein. And in some more complex cases, they might even do a nerve biopsy, which sounds intense, but it gives them definitive proof by letting them see the IgM proteins literally stuck to the myelin. All right, let's talk about what we can do about it. When it comes to treatment, it's really helpful to think of it as a two-pronged attack, where both paths are aimed at getting you back your quality of life. You really have to look at these two strategies together. On one side, you have symptom management. This is about using medications to dial down the pain and tingling just so you can get through your day more comfortably. But the other side, the bigger goal, is treating the underlying cause, using Waldenstrom's treatments to lower those IgM levels and stop the attack on your nerves right at the source. Now, this next point is so important for setting expectations. Nerves heal very, very slowly. So the main goal of treatment is to stop the damage from getting any worse. And because of that, just having your symptoms stabilize, that is considered a huge success. That's a win. Any improvement you get on top of that is a fantastic bonus. So you've got all this information. Now what? What are the next steps? Let's boil this all down into a real, practical action plan that you can bring to your doctor. Think of these as your personal mantras, your guiding principles. Number 1, your quality of life is the most important thing, period. If your neuropathy is getting worse and affecting your life, that alone is enough reason to talk about treatment. And remember to be patient because nerves take time to heal. And don't forget about supportive care, like physical therapy, which can be a huge help. Because at the end of the day, that's what this is all about. Your quality of life is priority number 1. Hopefully, with all this information, you feel more empowered, more confident to go have that conversation with your healthcare team and to really advocate for the care that you need and absolutely deserve.